Hello and welcome to our webinar on intensive behavioral therapy for obesity. My name is Jennifer Boniface and I'm one of the nurse analysts with the Provider Outreach and Education team. Today's webinar will focus on the clinical aspects for the Medicare Preventive Service of intensive behavioral therapy for obesity. Obesity affects both men and women, although it is slightly more common among women. Currently, more than 35% of men and 40% of women are classified as obese. National Women's Health Week is observed annually in May, starting on Mother's Day, or the second Monday of the month, and lasting a full week. This week provides an excellent opportunity to learn about intensive behavioral therapy for obesity, which is covered as part of the Preventive Services benefits under Medicare Part B. Our objective for today is to provide an overview of the clinical aspects for the Medicare Preventive Service of intensive behavioral therapy for obesity. And we will discuss background information on obesity, measurements used for diagnosing obesity, treatment options and preventive strategies, and the Medicare Part B coverage criteria for intensive behavioral therapy for obesity. So let's begin with reviewing some key facts and statistics. Obesity is a major public health concern in the United States, affecting more than 40% of adults, or around 2 out of every 5 Americans. Nearly 1 in 11 adults live with severe obesity. To put this into perspective, over 100 million Americans in the U.S. have obesity, with over 22 million classified as having severe obesity. In addition, 1 in 3 adults is considered overweight. Obesity also is more common in certain groups. For example, about 39% of those aged 60 and older are classified as obese. Among Medicare beneficiaries, obesity is highest among Black and African American adults and lowest among Asian and Pacific Islander adults. A person's total body weight is a result of the combined weight of muscle, bone, fat, and bodily fluids. Obesity occurs when an individual accumulates an excessive amount of body fat. This typically happens when a person consumes more calories than the body burns, with the extra calories being stored as fat. Medically, obesity is defined as having a body mass index of 30.0 or higher, while severe obesity is defined as a BMI of 40.0 or more. This condition isn't just about weight. It also carries serious health risks. Obesity significantly increases the risk of developing several chronic health conditions, including heart disease, diabetes, high blood pressure, high cholesterol, liver disease, sleep apnea, and certain types of cancer. It also raises the risk of premature death. There are several risk factors that can increase a person's chances of developing obesity. The first risk factor is unhealthy diet. Consuming a diet high in calories can contribute to weight gain and the development of obesity. And an example of this is regularly eating fast food and drinking sugary soft drinks. These foods and beverages are often packed with excess salt, sugar, and unhealthy fats. The calories they provide are typically low in nutritional value, often referred to as empty calories. Overeating can also occur when portion sizes are not controlled, leading to excessive caloric intake. Additionally, diets low in fiber, fruits, and vegetables can increase the risk of obesity. Without these nutrient-rich foods, it's harder to feel full, which can encourage higher calorie consumption, while also limiting important nutrients that support overall metabolic health. Next is lack of exercise or adequate physical activity. To lose weight, an individual must burn more calories than they consume. Regular physical activity helps helps the body burn calories and convert them into energy. And without enough physical activity, excess calories are stored in the body, which can eventually lead to weight gain. The third risk factor is insufficient or poor quality sleep. Adequate sleep allows the body to produce the hormones ghrelin and leptin, and these are the hormones that control appetite. Leptin helps reduce hunger and manage fat storage, while ghrelin stimulates appetite, promotes growth, and encourages fat production. When a person does not get enough sleep, ghrelin levels increase while leptin levels decrease. And this imbalance increases hunger, leading to overeating and the consumption of excess calories throughout the day, which can ultimately contribute to weight gain. Another important risk factor for developing obesity is gut microbiome. Research has shown that certain types of gut bacteria are linked to a higher likelihood of obesity. These bacteria tend to thrive in diets high in sugar, salt, and unhealthy fats. Unfortunately, these are the kind of foods that are very common in the typical American diet. Over time, this imbalance in gut bacteria can lead to weight gain and make it harder to keep a healthy weight. The next risk factor is advancing age. While obesity can develop at any stage of life, metabolism naturally slows down as a person gets older. And this means even with the same eating habits, weight gain becomes more likely. Aging also brings the loss of muscle mass, which can further increase the risk of obesity. The sixth risk factor for developing obesity is menopause. During menopause, there's a natural decline in the hormones estrogen and progesterone, which can lead to a slower metabolism and a tendency to store more fat, especially around the abdomen. The decrease in estrogen levels also affects insulin sensitivity and the way the body distributes fat. As a result, many women find they gain weight during or after menopause, with the average weight increase typically ranging from 12 to 15 pounds. Pregnancy is the seventh risk factor. Weight gain during pregnancy is a normal and expected part of the process. However, for some women, losing their weight after childbirth can be challenging. If healthy eating habits and regular physical activity are not maintained after pregnancy, the extra weight gained may persist, potentially increasing the risk of developing obesity over time. The eighth risk factor is genetics. Factors such as body, how much body fat a person has, how that fat is distributed, how efficiently the body uses and burns calories, and even appetite regulation can be inherited from parents. However, this does not mean a person with obese parents will automatically become obese as well. In fact, lifestyle choices are often more influential than genetics. Diet and physical activity have a much stronger impact on whether someone develops obesity, meaning healthy habits can make a significant difference regardless of genetics or family history. Another risk factor for developing obesity is the presence of certain underlying medical conditions, such as hypothyroidism, Cushing syndrome, polycystic ovary syndrome, or metabolic syndrome. For example, hypothyroidism slows down the metabolism due to low thyroid hormone levels, which can lead to fatigue, reduced calorie burning, and gradual weight gain. Cushing syndrome, caused by high levels of cortisol, a stress hormone, permits fat accumulation, especially around the abdomen, and increases appetite. Polycystic ovary syndrome, a hormonal disorder common among women of reproductive age, is associated with insulin resistance, increased fat storage, and difficulty losing weight. Metabolic syndrome refers to a group of conditions including high blood pressure, elevated blood sugar, excess abdominal fat, and abnormal cholesterol levels, which together increase the risk of obesity, type 2 diabetes, and cardiovascular disease. These medical conditions can make it more challenging to maintain a healthy weight, even with proper diet and exercise. Taking certain medications is the 10th risk factor in developing obesity. Some medications can cause weight gain, and if not balanced with a healthy diet and regular activity, they can contribute to obesity over time. And these medications include certain anti-seizure drugs, some beta blockers, birth control injections, glucocorticoids, insulin, and psychotropic medications such as certain antidepressants and antipsychotics. The next risk factor is high stress. Elevated levels of stress lead to an increase in cortisol, a hormone that plays a role in the body's stress response. High cortisol levels can trigger cravings for foods that are high in sugar, salt, and fat, and these cravings can lead to overeating and ultimately contribute to weight gain. And finally, the last risk factor we will discuss today is quitting smoking. Many people find themselves turning to food as a coping mechanism during the process of quitting smoking. Without effective strategies to maintain and manage the weight, the weight gain can gradually lead to obesity over time. While anyone can develop obesity, some people face a higher risk than others due to factors outside their control. One major influence is what we call the social determinants of health, things such as where a person lives, works, learns, and plays, which can strongly shape health outcomes. For example, food insecurity and limited access to healthy foods can increase health risks. When a person does not have reliable access to affordable, nutritious options, they are often forced to rely on cheaper, less healthy foods, which can contribute to weight gain over time. Another factor to consider is the barriers to physical activity. In some communities, there are few places to exercise, limited sidewalks or parks, or concerns about neighborhood safety. As a result, these obstacles can make it difficult for individuals to stay active on a regular basis. Economic instability also plays a major role. When individuals struggle financially or lack stable income, it can become challenging to afford healthy foods, access gyms or fitness centers, or other resources that support a healthy lifestyle. Finally, limited access to proper health care and community resources can further increase the risk of obesity. Without access to medical care or support programs, individuals may miss out on important guidance, early intervention, and the tools needed to manage their health effectively. Together, these factors show that obesity is influenced not just by personal choices, but also by the environment and resources available to each individual. Obesity is a serious health condition that significantly increases the risk of a wide range of medical complications. It is strongly linked to cardiovascular issues, including coronary heart disease, hypertension, dyslipidemia, myocardial infarctions, and cerebral vascular accidents. It also affects other major body systems. For example, it can impact the digestive system, leading to gastrointestinal issues such as abdominal discomfort, bloating, and altered bowel habits, as well as increasing the risk of gallstones, gallbladder disease, and fatty liver disease. Over time, carrying excess weight places continuous stress on the body, which can lead to bone and joint problems, including joint pain, joint stiffness, and osteoarthritis. One of the most well-known conditions linked to obesity is type 2 diabetes, which has a strong association with excess body weight. Obesity is also associated with an increased risk of several types of cancers, including cancers of the esophagus, liver, pancreas, breast, uterus, colon, and rectum. Beyond physical health, obesity can affect overall well-being. It's linked to conditions such as sleep apnea, urinary incontinence, and depression, all which can significantly reduce quality of life. It's also important to recognize that people living with obesity may face a higher risk of developing eating disorders, highlighting that this is a complex condition that affects both physical and mental health. Diagnosing obesity is a comprehensive process that starts with a detailed history and physical exam. This helps the healthcare provider understand the factors contributing to obesity as well as any related health risks. A key part of this process is the health history. By looking at several important areas, doctors can build a full picture of the patient's lifestyle and risk factors. One of the first things they review is the patient's current and past weight history. This helps identify any significant changes over time, whether it's weight gain or loss. Height is also considered alongside weight, since together they help determine whether a person falls within the obesity range. Healthcare providers should also look closely at dietary habits. This includes what the patient typically eats, how often they eat, portion sizes, and any patterns that may contribute to weight gain or nutritional imbalance. Next is exercise habits. Providers should assess how often the patient exercises, the type and intensity of activity, and whether the patient leads a generally active or sedentary lifestyle. Another important component is reviewing the patient's personal and family medical history. Understanding any existing conditions, as well as whether obesity or related conditions run in the family, can provide valuable insight into hereditary factors that may increase the patient's risk of obesity. In addition, providers should review any medications the patient is taking, since some can contribute to weight gain as a side effect. Psychosocial factors are also considered. Conditions such as depression or anxiety may influence eating habits, physical activity levels, and overall lifestyle choices. Finally, stress levels and coping mechanisms are evaluated, since chronic stress can affect appetite regulating hormones and can sometimes lead to unhealthy behaviors that contribute to weight gain. Once the health history is complete, the next step is the physical examination, which provides a direct assessment of the patient's overall health, including vital signs and a full head-to-toe evaluation. After the health history and physical examination are completed, the provider should assess the patient's body composition and fat distribution. One of the most common methods to evaluate obesity is by measuring the patient's body mass index, or BMI. While BMI offers a useful estimate of body fat for most individuals, it doesn't provide an exact measurement of obesity as it doesn't directly measure the actual amount of body fat. For example, because muscle is denser than fat, someone with a lot of muscle mass may have a higher BMI even though they don't have excess body fat. On the other hand, a person who has lost muscle mass may have a lower BMI even if they are still at risk for obesity. To calculate BMI, multiply the person's weight in pounds by 703, divide by their height in inches, and then divide by height in inches again. A link to the BMI calculator from the National Institute of Health's National Heart, Lung, and Blood Institute is included on the bottom of the slide for you to use to assist with calculating BMI. So let's take a moment to review what the different BMI scores mean. A BMI of 18.5 or below indicates being underweight. A BMI of 18.5 to 24.9 is considered within the healthy weight range. A BMI of 25.0 to 29.9 indicates being overweight, and a BMI of 30.0 or higher falls into the obesity range. And when we talk about obesity, it's helpful to think in terms of risk. A BMI of 30.0 to 30.9 indicates class 1 or low risk obesity. A BMI of 35.0 to 39.9 is considered class 2 or moderate risk obesity, and a BMI greater than or equal to 40 falls into class 3 or high risk obesity. It's also worth noting that individuals of Asian descent with a BMI of 23 or above may face a higher risk of health problems related to obesity. An alternative measure to assessing obesity is by measuring a person's waist circumference. Waist circumference reflects the amount of fat stored around the waist, commonly referred to as visceral or abdominal fat. It serves as a strong predictor of the likelihood of developing obesity-related health conditions and issues such as heart disease and diabetes. To measure waist circumference, a tape measure is wrapped horizontally around the abdomen just above the hip bones. The tape measure should be snug around the waist, but not tight enough to press into the skin, as this could affect the accuracy of the measurement. The measurement should be taken after the individual exhales. A person is at an increased risk of obesity-related medical conditions if their waist circumference is 40 inches or more for men or 35 inches or more for women. The main objective in managing obesity is to reduce overall body weight and shed excess fat. In fact, losing just 5 to 10% of body weight can help prevent or postpone many health issues associated with obesity. Let's start by looking at a weight loss approach centered on dietary changes. The treatment plan should focus on developing and incorporating new, healthier eating habits. It should be developed in collaboration with the person's healthcare provider to ensure it meets the individual's unique needs. The weight loss treatment plan may include several components. The first component is reducing daily caloric intake. A daily caloric intake of 1,200 to 1,500 calories for women or 1,500 to 1,800 calories for men is recommended to help with weight loss. The next component is making healthier choices when deciding what to eat. The updated Dietary Guidelines for Americans 2025 through 2030 encourages individuals to focus on whole foods in their diets. Consuming a variety of fruits, vegetables, and whole grains, while limiting added fats, sugars, refined carbohydrates, and salt, can support weight management. This also involves cutting back or eliminating sugary drinks and alcohol. These beverages are often calorie dense without offering much nutritional value. However, it is essential that the person remains hydrated throughout the day. Replacing sugary drinks with water, unsweetened tea, or black coffee can reduce overall calorie consumption while keeping hydration levels up. Controlling portion size is the third component of a weight loss treatment plan. Portion sizes should follow the recommendations in the Dietary Guidelines for Americans 2025-2030, emphasizing a variety of foods from all food groups. Because foods differ in calories and nutrient content, it's important to be mindful of how much is eaten. To help with this, the USDA offers a resource titled Daily Servings by Calorie Level, which guides individuals in determining appropriate serving sizes based on their daily caloric needs. Finally, the last component we will discuss is incorporating meal replacements. Meal replacement options, such as low-calorie shakes and bars, can substitute for 1 or 2 meals each day. The remaining meal should consist of real foods that are nutritionally dense. There are several other treatment approaches available to assist with weight loss. The first approach is to increase physical activity or engage in regular exercise. Participating in activities like walking, jogging, swimming, or strength training can help burn calories while also improving heart health, boosting metabolism, and maintain muscle mass. Additionally, regular exercise can enhance mood, reduce stress, and support long-term weight management by promoting healthier lifestyle habits. The Centers for Disease Control and Prevention recommends adults engage in at least 150 minutes of moderate intensity physical activity per week, along with muscle strengthening activities on 2 or more days each week. Another important approach involves behavioral change strategies. This includes behavior modification programs, which help people develop healthier habits like balanced eating, regular physical activity, and effective stress management. Counseling is also an important part of the process, helping to uncover and address emotional and psychological factors that may lead to unhealthy eating patterns. This kind of support is especially helpful for managing challenges like emotional eating, binge eating, and stress-related cravings, while encouraging a healthier life relationship and lifestyle with food. Overall, these strategies focus on promoting sustainable lifestyle changes by providing practical tools, setting realistic goals, and creating a supportive environment. The third approach involves weight loss medications in conjunction with a balanced diet, exercise, and behavioral modification. These medications function through different mechanisms, such as suppressing appetite, increasing feelings of fullness, or reducing fat absorption. When combined with a comprehensive weight management plan, weight loss medications can help improve outcomes and promote long-term success. Finally, medical procedures for weight loss can be considered, including gastric bypass surgery, laparoscopic gastric banding, gastric sleeve, gastric balloons, duodenal switch, gastric emptying systems, and vagal nerve blockade. These procedures work by reducing the stomach's capacity to hold food, limiting nutrient absorption, or altering digestive processes, all which promote significant and lasting weight loss. There are several strategies available to help prevent the development of obesity. The first is maintaining a healthy weight. BMI and waist circumference are useful tools for identifying whether someone is within the healthy weight range. Healthcare providers can tailor recommendations based on these measurements to help individuals maintain or achieve a healthy weight. Next is eating a healthy diet. The U.S. Department of Agriculture recommends focusing on nutrient-dense foods that are low in added sugars, refined grains, and artificial ingredients. A balanced diet that includes fruits, vegetables, whole grains, lean proteins, and healthy fats helps support overall health, boosts metabolic function, and makes it easier to maintain a healthy weight. Choosing foods that are rich in fiber, vitamins, and minerals while limiting excess salt and unhealthy fats is especially important for long-term well-being. The third strategy is keeping healthy foods readily available to encourage better food choices. When nutritious foods are easily accessible, people are more likely to make better food choices, reducing the temptation for processed, calorie-dense foods. Creating an environment that supports healthy eating can make a significant difference, helping reduce overeating and lowering the risk of weight gain and obesity. Practicing intentional or mindful eating is the fourth strategy to help prevent obesity. Paying attention to hunger cues, eating when truly hungry, and being conscious of portion sizes are all aspects of mindful eating. This approach promotes healthier food choices and can prevent overeating, a factor in obesity. Another strategy is staying hydrated throughout the day. Drinking water and unsweetened beverages like tea and coffee can curb appetite and support metabolic processes, which may assist with weight management. The sixth strategy is limiting alcohol intake. Alcohol is high in calories but low in nutritional value, which can contribute to weight gain. Additionally, alcohol can disrupt metabolism, making weight management more difficult. Cutting back on alcohol helps manage caloric intake, support overall health and weight goals, and reduce the risk of impaired decision making that can lead to unhealthy food choices. Getting regular physical activity is next. Regular exercise plays a major role in preventing obesity by burning calories and improving metabolic health. The eighth strategy is getting adequate amounts of sleep. adequate sleep is important for regulating hormones involved in appetite and metabolism. It also supports weight management by reducing cravings and improving energy balance. On average, adults require at least 7 hours of sleep each night. However, this can vary from person to person. Reducing stress is another effective strategy for helping to prevent obesity. Chronic stress can trigger emotional eating and alter metabolism, leading to weight gain. Relaxation practices such as yoga, meditation, and deep breathing can help alleviate stress, supporting healthier eating habits and overall weight management. And the final strategy we will mention is quitting smoking or never starting in the first place. Smoking cessation has numerous health benefits, from protecting the heart and lungs to reducing the risk of cancer. While some people may gain weight after quitting, this is usually due to lifestyle factors such as increased appetite, stress, or changes in eating habits, not the act of quitting itself. Encouraging smokers to adopt healthy behaviors like balanced eating, regular physical activity, and mindful stress management can help minimize weight gain and support overall well-being, potentially preventing obesity in the long run. The U.S. Department of Health and Human Services Office of Disease Prevention and Health Promotion developed the Healthy People 2030 initiative to highlight public health goals that help people, organizations, and communities across the U.S. improve their health and well-being. The focus of the overweight and obesity topic is to encourage healthy eating and regular physical activity to achieve and maintain a healthy weight. Additional information about the Healthy People 2030's objective for overweight and obesity is available on their website, and a link has been provided on the slide for your reference. Intensive behavioral therapy for obesity is billed using two codes. G0447 represents face-to-face behavioral counseling for obesity provided individually in 15-minute sessions, while G0473 is used for group counseling sessions involving 2 to 10 patients and is delivered in 30-minute intervals. Additional guidance on coding can be found in the Medicare Claims Processing Manual, Chapter 18, Section 200. And before we move on, I want to take a moment to address a pre-submitted question we received. The question asked which diagnoses are accepted for billing obesity. According to MLN 006559 Medicare Preventive Services Chart, the ICD-10 codes for intensive behavioral therapy for obesity include Z68.30 through Z68.39 and Z68.41 through Z68.45. There may also be additional ICD-10 codes that apply, and you can find individual change requests and the specific ICD-10 CM service codes that CMS covers on the CMS ICD-10 website. And Mary Sue has placed links in the chat to the MLN 00659 Medicare Preventive Services Chart and the CM ICD-10 page for you to review. For more information on the billing aspects of this preventive service, please watch our encore presentation titled Preventive Services, Intensive Behavioral Therapy for Obesity, and a link to this encore presentation has been placed on the resources slide at the end of the presentation. And I'm just taking a look at the chat real quick before we move on. Okay, let's move on. I don't see anything, so we're going to move on to coverage. Coverage for intensive behavioral therapy for obesity includes an initial screening for obesity using BMI, a dietary assessment, and intensive behavioral counseling designed to promote weight loss and diet through exercise. The counseling sessions should align with the 5 A's approach outlined by the U.S. Preventive Services Task Force of assess, ask about, assess behavioral health risks and factors affecting choice of behavior change goals and methods, advise, give clear, specific, and personalized behavioral change advice, including information about personal health harms and benefits, agree, collaboratively select appropriate treatment goals and methods based on the patient's interest in and willingness to change the behavior, assist using behavior change techniques, self-help and/or counseling, aid the patient in achieving agreed-upon goals by acquiring the skills, confidence, and social and environmental supports for behavior change, supplemented by adjunctive medical treatment when appropriate, and arrange, schedule follow-up contacts in person or by telephone to provide ongoing assistance and support, and to adjust the treatment plan as needed, including referral to more intensive or specialized treatment. To learn more about the 5A's approach or to dive deeper into each of the 5A's, please refer to the USPSTF's Behavioral Counseling Intervention and Evidence-Based Approach. Detailed information on the 5A's can be found midway down on the page under the 5A's Organizational Construct for Clinical Counseling. So now let's take a closer look at Medicare coverage criteria for this preventive service. Medicare covers intensive behavioral therapy for obesity for patients with Medicare Part B, provided they meet the following criteria. The patient needs to have a body mass index greater than or equal to 30 kilograms per meter squared. The patient needs to be competent and alert during the time of counseling, and the counseling must be delivered by a qualified primary care physician or other primary care practitioner within a primary care setting. And we received a pre-submitted question about who can provide the service and which places of service are covered, so I want to briefly go over a few definitions to clear things up. Under National Coverage Determination 210.112, a primary care physician is defined as a general practitioner, family practice practitioner, general internist, or obstetrician or gynecologist. A primary care practitioner is defined as a physician specializing in medicine, internal medicine, geriatric medicine, or pediatric medicine, or as a nurse practitioner, clinical nurse specialist, or physician assistant. And I did place a link to the National Coverage Determination 210.12 on the resources slide in the end of the presentation. According to the MLN 006559 Medicare Preventive Services Chart, CMS defines a primary care setting as a place where clinicians deliver integrated, accessible healthcare services and are responsible for addressing most patient healthcare needs, developing a sustained patient partnership, and practicing in the context of family and community. CMS further clarifies that they exclude emergency departments, inpatient hospital settings, ambulatory surgical centers, independent diagnostic testing facilities, skilled nursing facilities, inpatient rehabilitation facilities, and hospices from the category of primary care settings. So as long as the patient does not, or the care is not given in one of those excluded settings, it should be covered as a primary care setting. So links to these sites have been placed on the resource slide at the end of the presentation. Medicare covers up to 22 visits over a 12-month period, including billing codes G0447 and G0473. The schedule is structured to provide ongoing support. In the first month, patients can have one face-to-face visit each week. For months 2 through 6, visits occur every other week. Then, from months 7 through 12, patients are eligible for one visit per month if they have achieved at least a 3 kilogram or 6.6 weight loss during the first 6 months. This plan is designed to keep patients supported and motivated as they work toward their weight loss goals. At the 6-month visit, the patient's obesity status and progress toward weight loss must be reassessed. To be eligible for an additional 6 months of monthly visits, the patient must achieve a minimum weight loss of 3 kilograms or 6.6 pounds. If this is not met, the patient's readiness to make changes should be reassessed, and their BMI should be reevaluated after another 6 months. There is no copayment, coinsurance, or deductible for intensive behavioral therapy for obesity, as long as it is provided by a healthcare professional who accepts assignment. HCPCS code G0447 and G0473 are telehealth eligible, and the requirement can be met through audio-only interaction. When documenting, be sure to record the patient's BMI of 30 or higher, along with a detailed discussion of lifestyle changes, clearly defined goals set with the patient, and updates on progress during follow-up visits. Additionally, note in the medical record whether the patient has successfully lost at least 3 kilograms or 6.6 pounds in the initial 6 months of intensive behavioral therapy. If the BMI falls below 30, consider whether the frequency of counseling should be adjusted based on the patient's progress, ongoing risk factors, and overall health goals. Record the time spent during each session, as G0447 and G0473 are time-based codes, and include the appropriate ICD-10-CM diagnosis code for obesity. Finally, make sure to update and document the patient's most recent BMI at every visit. Keeping this current helps demonstrate medical necessity, tracks progress over time, and supports compliance with Medicare documentation and billing requirements. So before continuing, let's answer another pre-submitted question. And the question asks if HCPCS code G0447, Intensive Behavioral Therapy for Obesity, can be billed on the same day and by the same provider as a G0438 initial annual wellness visit or G0439 subsequent annual wellness visit. Intensive behavioral therapy for obesity may be furnished and billed by the same provider on the same day as an annual wellness visit, as long as both services are medically necessary and separately identifiable. To indicate that the annual wellness visit is a separately identifiable service from the intensive behavioral therapy for obesity counseling, modifier 25 must be appended to the annual wellness visit code. Documentation must clearly show that both services were medically necessary, independently performed, and did not overlap in content, with time spent on intensive behavioral therapy for obesity not counted toward the annual wellness visit components, such as the health risk assessment or personalized prevention plan. Keep in mind that the patient must meet the Medicare eligibility requirements for this preventive service in order to bill for it. When these requirements are met, billing both the annual wellness visit and the intensive behavioral therapy for obesity on the same day by the same provider is permitted under Medicare guidelines. Now let's go over a few additional documentation requirements for intensive behavioral therapy for obesity. This includes the date the service was provided, along with the office visit notes for that specific date. The record must also show that the counseling was delivered by a Medicare eligible physician or qualified non-physician practitioner in a primary care setting. In addition, documentation should confirm the patient was alert and competent during the counseling session. It must also clearly support the medical necessity for the intensive behavioral therapy for obesity. Finally, all documentation must be dated and include the provider's signature and credentials. And one last point, additional detailed documentation may be needed to support the encounter and ensure proper reimbursement, particularly for more complex cases. Intensive behavioral therapy for obesity is covered in both rural health clinics and federally qualified health centers. In these settings, the service must be delivered by a qualified primary care provider, meaning a clinician who meets CMS's definition of an eligible RHC or FQHC practitioner. Medicare also requires that the service be provided directly by one of these eligible practitioners within a primary care setting. This approach helps ensure proper clinical oversight while also supporting continuity of care. Both rural health clinics and federally qualified health centers are considered primary care settings under Medicare, as they are specifically designed to deliver comprehensive, community-based primary care, particularly in underserved or rural areas. The core clinical documentation standards for rural health clinics and federally qualified health centers align closely with those used in other healthcare settings. As a reminder, these requirements are listed on this slide for your reference. Where things differ is in the billing and reimbursement. RHCs are reimbursed under the all-inclusive rate, while FQHCs are reimbursed under the prospective payment system. So even though the documentation expectations are similar, the way these healthcare settings get reimbursed works a little differently than in standard primary care settings. And for more information on RHCs and FQHCs, please refer to the CMS publications MLN 006396, Information for Rural Health Clinics, and MLN 006397, Federally Qualified Health Center. And links have been placed on the resources slide at the end of the presentation. Obesity significantly raises the risk of serious health issues such as heart disease, diabetes, high blood pressure, and stroke. These conditions are often interconnected, and obesity can worsen them, potentially leading to even more health complications if not addressed. However, many of these health risks can be prevented or delayed through weight loss. Shedding excess pounds can enhance overall health, reduce the risk of chronic diseases, and improve quality of life. Medicare provides coverage for intensive behavioral therapy for obesity for eligible individuals who meet specific criteria as part of its preventive services benefits under Medicare Part B. So as a recap, during today's webinar, we discussed background information on obesity, measurements used for diagnosing obesity, treatment options and preventive strategies, and Medicare Part B coverage criteria for intensive behavioral therapy for obesity. On this slide, I provide several resources with links to the information we discussed today. Please refer to the slide as a helpful resource when reviewing the presentation. So we are now at the end of the formal presentation. Please remember, if you have any questions, please put those questions in the chat. So before we answer questions in the chat, I want to go over one other pre-submitted question we received. And the question asks, does this service have to be provided as part of our cardiac rehab program? And if so, can we bill it or is it included? G0447 and G0473 are not required components of a cardiac rehabilitation program. These HCPCS codes represent Medicare preventive services for intensive behavioral therapy rather than cardiac rehabilitation services. Because cardiac rehab is a bundled program that already includes education and counseling, any obesity counseling provided within that program is considered part of the bundle and cannot be billed separately. However, if the service is provided outside of cardiac rehab, is clearly distinct, and meets Medicare's requirements, it may be billed separately. In those cases, documentation should show the service was separate and medically necessary. This includes a BMI of 30 or higher, the time and duration of the face-to-face visit, and the specific counseling provided. It should also clearly demonstrate that the service was not duplicative of cardiac rehab with separate documentation and individualized treatment plan. And I do not see any questions in the chat, so in the interest of time, we're going to move forward. Please take a moment to complete the survey and share your feedback. We'll use your feedback to develop topics for future education events. And you can access the survey by either clicking the link in the chat or by visiting the CMS Qualtrics page after the webinar. And this is what the CMS Qualtrics page looks like. It has that little yellow triangle. In a few minutes, you'll receive an email thanking you for attending, which includes your certificate of achievement and link to the survey. If you need contact hours for continuing education, they'll also be in the email. If you don't see this email, check your spam folder. If you called in, email us at that address we gave earlier, wps.gha.education@wpsic.com, with the webinar name and phone number, and we'll send you your certificate of achievement. If you think of any additional questions after today's event, you have 7 days from today to submit them. Send them again to that education mailbox at wps.gha.education@wpsic.com and put the title of this webinar in the subject line. However, if you have claim-specific questions, please don't direct those questions to us, but rather to our customer service department, as we don't have access to your claim information and therefore are unable to look up claims. Also remember that we cannot accept any type of PHI or PII via email. Finally, on behalf of Mary Sue, myself, and all of Provider Outreach and Education, thank you for attending today's webinar on intensive behavioral therapy for obesity. As a reminder, this presentation will be posted as an encore presentation on our Training Center page on our website. Remember to take the survey with the link provided. We look forward to your survey comments and hope to have you join us at future events. You may now disconnect.